Hey guys, it's Mariana from Mech Physio. Just wanted to come on here and talk to everybody about a really interesting case we had in the clinic back in August. So really briefly, we had a patient come in with severe ringing in their ears and an onset of vertigo for a month and a half, dizziness, ringing in the ears, and just feeling really crummy. And we noticed that his neck was shifted out of position. So we're like, oh, okay. And he also had neck tension and neck discomfort. So we're like, okay, maybe this has something to do with it. Long story short, the ringing in his ears and the dizziness and just that whole feeling of neck tension and just feeling bad was all from his neck. So I thought that was very interesting because we don't usually see people come in with those, I guess, upper cervical neurological symptoms where our eyes and our balance are affected and our ears are affected. So I'm sure there's more like that out there. But what I did find on YouTube is a case, not exactly, but like almost just like this man that we saw, where it shows that ringing in the ears, tinnitus is what it's medically called, and dizziness or a feeling of unsteadiness in your brain can stem from a neck problem, a mechanical neck problem where something is like stuck or jammed or something and needs to be mechanically released through physio and McKenzie method therapy. So yeah, here's the video. It's a little bit long, but the doctor, the medical doctor goes through kind of all the red flags and asks all the questions to make sure that this tinnitus, which this lady reports is 8 out of 10, which is pretty high. Like it's a lot of ringing in the ears. So he goes through all these red flags, and it's really interesting to see how this lady just goes from 8 out of 10 ringing in her ears constantly for the last, I think it was 5 or 6 weeks, to 0. So just by looking at neck restrictions and identifying like what's the loading pattern we have to use and what movement should we use to help this lady clear up the ringing in her ears. So it's a long video, but it's good. You can see like the change in her face. She's like, I don't think it's ringing. Anyway, very interesting. So if there's anybody out there and you're kind of having this problem of dizziness that kind of came out of nowhere and tinnitus, and your doctor can't really figure it out and they send you for tests and CT scans like this gentleman did that came to our clinic. He was scanned and everything was perfect. So if you're out there and you're having these funny symptoms of dizziness and vertigo and you don't know where they're coming from, and you happen to work at a desk or you have a history of neck tension or neck pain, consider seeing a physio that knows McKenzie method, because that might be exactly what you need.